Hi Shelly, my name's Ashley and I'm going to be your LPN today.
Oh, hi.
Can you tell me your name and date of birth, please?
Shelley Lovely, January 31st, 1966.
Okay, great. So we're going to be changing your dressing today and cleaning up your wound. Before we do that, do you have any questions?
Is it going to hurt?
It shouldn't hurt that bad. There might just be a little pressure though.
Okay.
Okay, great. So I'm just going to grab these. I'm just going to check the order real quick to make sure. Yep, Shelly Lovely, dressing change. Okay.
We're good?
Great. Okay, so before we begin, today I'm going to teach you how to change it and clean it yourself, so when you go home, you can do it on your own.
Sounds good.
Okay? Great. So first, we're going to start with hand hygiene. Boop, boop.
You just rub?
Yep. Just rub it in until it's dry.
Okay.
Okay. And then we're going to put our gloves on and take the old bandage off and see what it looks like. Okay, the tape might just pull a little bit.
Okay. Oh, that wasn't too bad.
Ooh. Okay, so we're just gonna set that there.
Do you think it's infected?
No, I don't. It looks really good to me. It's good in color. And there's a little bit of drainage, as you can see here on the old bandage, but it's not.
Is that normal?
Yep, it's not a lot, and it's this is normal. It's just a light pale pink color. They would call it serous, but it's a light pink color. So
Okay.
it's normal, and it's just a little bit, and it's to be expected because you have a wound there.
Okay.
So we're just gonna throw out the garbage now because we're done with it. And I'm just gonna palpate it a little bit and see if there's any swelling. It looks pretty good. Is there any pain?
No, no pain. Feels
No?
good.
Okay. Pain is usually the first sign of infection, so if there's no pain, and the color looks good, and there's no strong odor with it, so that's good. Okay, so now we're gonna change our gloves again, take these ones off, and do hand hygiene again, because we touched the dirty bandage and we were poking at your wound. So I'm just gonna do this again.
So it's okay to waste some gloves?
Yeah, it's better to waste, well, you're not really wasting them. It's, you've touched the dirty bandage, so now you're gonna touch all these clean supplies, and you don't want to contaminate your wound with the dirty stuff. So.
Okay.
Okay. So this is your dressing tray. I'll fold it up here. And it's a sterile field, so there's a lot of specific instructions that go along with it. I'm just gonna move these off here. So it comes in this little bag, and I'm sure you'll be sent home with some, or extramural will get you some.
Okay.
And so inside is everything you need to clean your dressing except for the saline.
All right.
So the first step is that you need to open it away from you, because if you open it towards you, then you will be leaning over your sterile field and you could contaminate it.
All right.
Okay, and then we're gonna pull the sides, and you can touch the bottom because that's the part that's gonna be up against the table. But other than that, there's a 1-inch border all around that you can touch, but you cannot touch the center. So we'll just pull that. And this one, you lift this and you get your tweezers out. And you can just pull it like that and move it all around. is just a drape. It will go just under your arm so we don't get anything on the bed or your Johnny shirt.
Okay.
Okay. And then you're gonna take the forceps and just move them over and make sure they're pointing down so they don't accidentally get knocked over and compromised. And then these ones, you can set them down, just the tips on the sterile field because you've touched the ends of it. And then you're gonna pick these up and you're gonna separate all the 2x2 squares.
Seems like a lot to remember. So first I get my dressing tray and I open it up away from me first. And then it's got a 1-inch border all around it that I could touch if I had to.
Yes, you can touch it.
But the middle part I can't touch because it's sterile.
Yes.
All right, so then I can use my first pair of tweezers to position it where I want the tray.
Yep.
And then I use those tweezers to set up my tray with the other tweezers.
Yes.
Put them in the corner.
Yep.
Okay.
And then you just pull these all apart so you can just pick one up at a time and they're not all stuck together. Okay.
Okay.
And then you're going to set those back in there, face down again. And then you're going to grab your saline solution, and it says right on it, sterile sodium chloride. So you're going to check it 3 times. That's the rule to make sure that's the one you want. Okay? And if it has already been opened, the caregiver that used it before would normally put a piece of tape on the back with the time and date that they opened it. And if it's less than 24 hours, then you can use it again. It's fine. You just have to lip it. So you would just take it and just go like that to get the top layer off.
Okay.
But if it's over 24 hours, you can't use it. You have to get a new one.
All right.
Okay?
So my saline, I have to check, make sure it's the right thing first. 3 times.
3 times.
And then check to see if it's expired. And check to see if when it was opened.
Yep.
If it was opened less than 24 hours, I can use it.
Yes.
But I have to lip it first.
Yep.
And if it's more than 24 hours, I should throw it out and get a new one.
Yes.
Okay.
But you change your dressing twice a day, so you'll be able to use it at least twice.
Okay.
And then you're just going to put it in this little pocket. Tip her down. Okay, and then you're going to take both of your forceps, one in each hand, and grab just one 2x2 and place it in the saline and just put it, completely soak it. And then when you pick it up, you don't want this sopping wet 2x2 on your arm, so you're just going to have to wring it out first with your forceps, and you just grab both ends and just wrap it around and squeeze it out. And then you're going to put it over in the other container part, and you're just going to grab each corner and fold it up like a present.
Okay. 1 2x2, soak it, wring it all out, and then fold it up like a present.
Yep. And then you just pick it up just like this. And you come over here, and you always want to clean to dirty, so you'll start right on the incision and go outwards.
Okay.
But you just take this and you go like this, and you only use it once. And then you throw it out.
Okay.
And you just go down once and in the garbage.
Always clean to dirty.
Yes. And then you'll take another one and do the same wringing out motion. And again, put it back over here. Sometimes they're difficult. And then you just pick up a corner, pick up the other one, just fold it up like a present is the best way to describe it.
Okay.
And then you'll want to leave these ones in here so you don't accidentally touch anything with them.
That's a good idea.
So this time we're not going to go on the incision, but we're going to go right beside it, just on one side.
Okay.
Okay. And in the garbage.
All right.
Just only once. And pick up another one. And wring it out. Okay, and then we'll do it on this side, the same thing, just right down the side of it and in the garbage.
Okay.
And not everybody does this, but I'm going to, is you do it again, just a little further over on both sides.
Just to make sure it's really
Just
clean.
to make sure that there's nothing that's gonna get in your wound.
Okay.
It does take some time, but it's important that you clean it thoroughly so you don't end up with an infection.
We don't want that.
Nope. So just go down that side
One more.
and one more. So do you understand how we clean it?
Yeah, I do. But am I going to get to practice it again, or will you be here to go over it again with me?
Yep, we'll go over it every day because you need to change your dressing every day. And
Is it every day or twice a day?
Well, it's twice a day, every day.
Okay,
And then just one more on this
that
side.
makes sense.
And so we'll go over it again and again until you go home, and then you'll be on your own, I guess.
Okay,
Okay.
I think I can handle that.
So you understand how we clean it, just one at a time, just straight down,
Clean to dirty.
clean to dirty.
Okay.
Okay. So now we're gonna dry it because it's wet, and you don't want moisture in with your wound because that can cause infection and skin breakdown.
Oh, okay.
So we're gonna take your forceps again, and we're gonna pick up a 2x2. We're not gonna put it in the saline, but you can set it right down on your sterile field because it's dry and everything is sterile.
Right.
And you do the same thing and fold it up like a present. And you're just gonna pinch it. And same thing, clean to dirty. So straight down once and in the garbage. And do it again.
So I dry the same way as I clean.
Yep,
Clean to dirty.
the exact
Okay.
same way. And once down the side. And once down the side.
Perfect.
Okay, so then you can set those back in your tray. And I should have opened this before I put my gloves on. But we're gonna pretend like I did for the video. So you would just open this and just dump it out on your sterile field, or you can grab your forceps and pull it out. And your tape, you can just hook it on the side of your table.
Sticky.
There, it's sticky. So that's all dry now. You just dry it the same way you clean it.
Okay.
Okay, so now we're gonna take this clean bandage and we're just gonna place it right on top. So now that that's covered, I'm just gonna
That's
tape
great.
it
Good to have that done.
just like that.
Awesome.
Now you don't have to do it again until this evening.
Perfect. Thank you so much.
You're welcome. Do you have any questions before I clean this all up?
The only thing I was wondering is, when do my stitches come out, Ashley?
Well, I'm not sure, but I can go and ask your RN or your doctor, and they'll be able to let you know.
Okay, thank you.
Okay, you're welcome. And your call bell is right here, and if you need anything, just ring, and I'll come back.
All right, thanks.